Welcome to the video series, Occupational Therapy for the Stroke Survivor at Home. My name is Alyssa. I'm an occupational therapist and certified stroke rehab specialist. If you're a stroke survivor or caregiver, my goal is to provide you with information and advice to help make your lives easier in the home setting. Any information I reference throughout this video series will be made available to you in the video description. Let's get started. Welcome to this episode on medication management. A stroke is a very serious condition. Often following a stroke, survivors have a variety of conditions that require treatment to reduce further medical problems. As you may recall from the episode on stroke education, there are many lifestyle changes that can be made to improve health following a stroke and reduce the chances of another stroke occurring. However, much of these conditions are treated with medications. Medication can be overwhelming and a challenge to manage for both stroke survivors and the caregiver. My goal for this episode is to help the stroke survivor better understand common concerns and some helpful tips regarding medication management that are typical for a stroke survivor. I want to advise viewers not to make any changes to medication regimens that have been prescribed unless otherwise advised by a physician. It is imperative that you follow the prescription that is provided to you by your doctor. Throughout this episode, I would like to review the importance of taking and adhering to taking medications as prescribed following a stroke. I will talk briefly about common medications that are prescribed to stroke survivors, what they are intended to do, and why it is important to take them. We will switch gears a bit and talk about the different cognitive and physical impairments following a stroke that survivors may be dealing with that impact their ability to take medications, and provide caregivers with further insight to build understanding regarding any challenges that stroke survivors may face with medication management. We will finish up talking about several strategies to address these challenges stroke survivors may be facing and ultimately improve the ability to adhere to medication regimens as prescribed. Let's discuss the importance of taking and adhering to the medications that are prescribed for stroke survivors. It may be beneficial to refer back to the stroke education episode prior to watching this episode to review the typical causes of stroke and the risk factors that increase the likelihood of a stroke occurring. Most often, medications prescribed to stroke survivors are intended to treat side effects or conditions that result from the stroke or that may have even led to the stroke in the first place. Therefore, many of the medications prescribed are intended to treat common risk factors. Most commonly, strokes occur due to a high blood pressure and often require medication to manage that. Additionally, the same applies for heart conditions. Most commonly, atrial fibrillation can be a risk factor for stroke and can be managed with medication. While there are other risk factors such as high cholesterol, blood sugar fluctuations, and stress that can be modified and improved with lifestyle changes, these conditions can also be impacted by medications. Therefore, doctors often prescribe medications to assist in treating these conditions to improve health and reduce the risk for another stroke. Now that we have reviewed the risk factors and conditions that are related to and often treated with medications, either before or after a stroke, let's briefly discuss some common medications that are prescribed. Let me be clear about something first. These are not the only medications that may be prescribed, and there is a chance that a stroke survivor or someone at risk for stroke may not need these medications. This is simply to review a few common medications stroke survivors often see prescribed from their doctor. Also, prior to discharging from a rehabilitation facility or from leaving a doctor's appointment, be sure to ask your healthcare provider what the medications are that you are being advised to take and ask why. First, antihypertensives are often prescribed to help control blood pressure. Antihypertensives are often prescribed to those who have hypertension or high blood pressure. These medications are intended to lower blood pressure to a more manageable level. Remember, a typical blood pressure is 120/80. Therefore, doctors typically like to see stroke survivors' blood pressure close to this number, but be sure to get with your physician about what a normal blood pressure should be for you. Next, we have statins. These are often prescribed to manage one's cholesterol. Having an elevated cholesterol puts one at a greater risk for stroke and other health complications. Therefore, using medications to control this can be beneficial. Next, we have antiplatelets and anticoagulants. Both work to prevent the formation of blood clots in the body, which, as you may know from the stroke education video, blood clots are dangerous as they can lead to stroke. Therefore, medications are often warranted to reduce the chances of blood clots, especially for those prone to forming them. Lastly, beta blockers are commonly prescribed for those who experience different heart conditions that may be impacting the heart rate or rhythm, such as atrial fibrillation. These medications can help regulate and control the heart rate to a healthier state. These medications are commonly prescribed to stroke survivors, but remember, this list is not all-inclusive. Also, please remember to take the medications that your doctors have prescribed for you, and remember to always ask what the medications you have been prescribed are for. Despite the seemingly simple process of receiving a prescription for a list of medications, there are several factors that a stroke survivor may face that make taking medications as prescribed quite difficult, especially to do it so independently. As we know, after a stroke, a survivor may face different cognitive deficits impacting independence with medication management. It is not uncommon following a stroke that survivors may have trouble with their short or long-term memory. Impaired memory can impact medication management for the stroke survivor, making it difficult to recall when medications are to be taken or if they were even taken in the first place. Dangerous outcomes could result if a stroke survivor fails to remember to take their medications or if they were to accidentally take their medications more than once due to forgetting. Additionally, stroke survivors sometimes have difficulty keeping up with the day and time. Therefore, if a medication is prescribed to be taken in the evenings only, someone who has trouble orienting to time of day may be unable to take this medication correctly. Many stroke survivors have great difficulty with problem-solving abilities. This refers to exactly as it sounds. If a problem arises, stroke survivors may have difficulty navigating the appropriate response to said problem. For instance, if a stroke survivor is unable to retrieve medications from their pharmacy, they may be unable to reach out for help, call the pharmacy, or navigate this problem independently. A stroke survivor may have difficulty following directions. Therefore, reading and following a prescription may be a challenge, particularly prescriptions that have terms associated with them. For example, taking a medication that is as needed depending on how high blood pressure may be might be a difficult set of directions to follow. Furthermore, stroke survivors may have a hard time multitasking. Therefore, a stroke survivor may have difficulty juggling both medications as well as remembering to brush their teeth or cook breakfast and get dressed for the day. Lastly, many stroke survivors struggle with general confusion. This in general can make taking medications and taking them as prescribed difficult for the stroke survivor. Let's talk about a couple ideas and strategies that can be easily implemented to improve medication adherence and management. There can be several different strategies that work for you and your caregiver to improve independence towards taking medications. However, here are a couple ideas to consider. First and foremost, stick to a routine. Make taking medications a habit. If a prescription requires the stroke survivor take a certain medication every morning and night, stick to it consistently until it is a part of a routine, forming a habit. This only happens with consistency. Use reminders. Set alarms on your clock or phone to take medications as prescribed. You can use checklists or sticky notes or any visual cue around the house to remind a stroke survivor to take the necessary medications. Simplify the labels on the pill bottles. Place a piece of paper over the label that simply states something like, "Take one this morning," as opposed to the prescription label that may read something like, "Take one time a day in AM by mouth." Use locking pill bottles. There are pill containers designed with a locking system where a caregiver can set a code on it. This way, the stroke survivor cannot take the medication without the assistance and supervision from a caregiver using the proper code. Lastly, let's look into pill sorters and the upside-down method. One common and easy strategy that can help with remembering to take medication and take them at the right times of the day is by using a pill sorter. Oftentimes, it is best if a caregiver and stroke survivor get together at the beginning of the week and help sort their prescribed pills into each day as instructed. There are many different types of pill sorters, but here are a few. You can see there are simple options that are for 1 week and are just sorted to be taken on a single day at one sitting. There are other options that divide the pills into morning and night for each day. If necessary, there are options where you can sort the medications throughout the week and day between morning, noon, evening, and at bedtime. Sometimes these dividers even have allotted times labeled on them. Remember, you don't want to overcomplicate the process of taking medications, but sometimes sorting them out for the week is a good way to organize and keep track of the necessary medications you are to take and eliminate all of the pill containers they come in. Here's one example of how to sort pills using a pill sorter. This particular one is divided by AM and PM, morning and night. You see in this example, 1 pill is to be taken in the morning and 1 pill is to be taken in the evening. The caregiver or stroke survivor could then take each pill and place it into the sorter as prescribed. Be sure that you have sorted them correctly, and then you are ready to take your medications for the week and no longer have to hassle with the pill bottles. The upside-down method is another strategy that can be used to help serve as a cue to show whether or not medications were taken for the day. This is a higher-level strategy that requires learning a new habit. Essentially, once you have taken a medication, put the lid back on, flip the bottle over. Do this for each of your medications. Once all medications are flipped over, that means you're finished taking your medications for the day. If you were to forget later in the day whether or not you took your medications, you can look back to see if the bottles are flipped over or not. If they're not flipped over, then you have forgotten to take the medication. The key to this here is remembering to flip the bottles back over at the end of the day so that you can repeat this strategy the next day. Unfortunately, not only are there cognitive deficits that can interfere with medication management, there are physical deficits that are common among stroke survivors that impact the carryover with medication adherence. First and foremost, having limited mobility reduces ease of and ability to access medication. If a stroke survivor is unable to reach medications or to travel where the medications are stored, this will reduce carryover with taking medications as prescribed. Additionally, the containers or bottles that medications are often in can be difficult to open in order to improve the safety with storing medications. However, this can make it difficult for a stroke survivor to access the medications as well. Oftentimes, stroke survivors can have a difficult time with swallowing following a stroke. Therefore, swallowing large pills or multiple pills can be a great challenge and can potentially be dangerous, resulting in aspiration if not careful. A stroke can cause vision impairments that can reduce a survivor's abilities to read small prescription labels and can impact a stroke survivor's abilities to take medications safely. Last but not least, stroke survivors may be at risk for falls if mobility poses a challenge following the effects of a stroke. It is important to consider that some medications are at risk for increasing the likelihood of falls. Some medications may increase the likelihood of dizziness or drowsiness, which can increase your risk for falling. Therefore, physical deficits following a stroke may be a threat to adhering and taking medications as prescribed as well. Let's look at some strategies to improve medication management for those with physical deficits following a stroke. There are many strategies that may work for you. Here are some ideas to consider. First and foremost, consider the location of medications. Are they placed at a reasonable height or even in an accessible room in the house where the stroke survivor can reach them to be able to take them? Consider the stroke survivor may only be able to reach so high or so far onto a countertop. Or if the stroke survivor is wheelchair bound, be sure the medications are located where they can use their wheelchair to navigate there. Use large labels. The labels on prescribed medications are typically a small font with several words. This can be difficult to read, especially with vision impairments. Use a piece of paper or thick marker and write simple 1 to 2 word directions on each bottle. Use shapes or symbols as needed if that's easier to see. Perhaps write a red X on medications that are no longer to be taken. Modify the container the medications are in. Here shortly I'm going to show you a few different types of containers that medications often come in. However, if these containers are too difficult to open, consider something different. Use a Ziploc bag, a pill sorter, a small Tupperware, a jar, whatever makes it easier to access. If the stroke survivor has a difficult time swallowing medications, please get with your primary physician or a speech therapist to review strategies to assist with this. However, if you have confirmed with your doctor, consider using a spoon and taking medications with a bite of applesauce or pudding to be sure medications are swallowed more easily. Another idea is to use a pill crusher and crush medications, turning them into a powder that can then be mixed with applesauce or pudding. However, remember, not all medications can be crushed, so please check with your doctor before doing this method. Lastly, you can always reach out to the pharmacy directly for any different strategies and methods that they can provide for you as a stroke survivor to be sure that you're taking your medications as necessary. They can deliver medications to your house, use different, more readable labels, and provide different, more accessible containers. Let's take a look at some common container styles for medications. Most commonly, medications will come in a few different types of lid varieties. There are twist tops, where you only twist to remove and replace the lid. There are pinch and twist tops, where you are to squeeze the lid, push down, and twist to remove and replace the lid. Or lastly, there are lids that require you to push down and twist to remove and replace them. All of these pose different challenges with accessing medications, especially with physical deficits from a stroke. Therefore, you may have to modify the type of container that you are storing your medications in. Consider this quick fix trick. This is a medication with a push down and turn style lid. This can often be a tricky physical skill to do, especially with weakness or limited use of one arm or hand. However, many of these tops are designed so that you can simply remove the lid or have assistance to remove the lid initially. Once removed, turn the lid upside down and twist it back on. You have successfully turned this medication into a twist top container, eliminating the difficult aspect of pushing down while simultaneously turning. Try this with your medication bottles at home, if it helps. In this episode, we reviewed several different areas related to medication management. We started by discussing why it is important to take medications as prescribed in the first place. We reviewed a general list of common medication types that may be prescribed for stroke survivors. We discussed different cognitive and physical factors that a stroke survivor may face that affects their independence with taking medications as necessary. We went over a few strategies that can be implemented in the home setting to improve independence and consistency with medications. Please remember to always consult your healthcare providers before taking any new medication, altering the plan for medications, and/or altering how you are going to take the medication. Remember, you can always use your pharmacy as a resource with any questions you may have about a medication or how to make it easier for a stroke survivor to take a particular medication. Thank you for watching. I hope this video helped you as a caregiver or stroke survivor with maximizing independence and improving your quality of life in the home setting. Please utilize the comment section below with any questions or comments about the video. Stay tuned for more episodes. Thanks again for your support.